Okay, folks, it's 12:03. We're going to make a start. Thank you so much for joining us here today to be part of our ComStar launch. My name is Madeline Cruz. I'm a speech and language therapist by clinical background, and I'm based at City, University of London. Together with my colleague, Professor Rebecca Palmer, who's also a speech and language therapist by background, based at the University of Sheffield, we jointly lead the ComStar project and will be the hosts for your webinar today. Our plan is for me to talk through our motivations for ComStar and to introduce you to the team, and then I'll be handing over to Rebecca, who will share with us what we're doing through the 3 years of our project and share the different ways in which you might want to take part in ComStar. So just to let people know, you're welcome to have your camera on and off. We would love you to mute your microphone, please. We are recording the event and we'll have a short Q&A at the end of the presentation. We would like, please, for you to hold your questions and your comments until the end, and then we'll stop slide sharing and we just invite you to use the raise your hand button or write in the chat area when we come to that time point. Okay. So, welcome to our ComStar launch. ComStar stands for Communicating in Stroke Care and Rehabilitation. The focus of the project is developing staff communication skills training, and the purpose is to help our stroke patients with communication impairments have better access to and better inclusion in their stroke care and rehabilitation. We're a 3-year research project, and we are entirely focused on developing this communication skills training for staff. We're going to do it in a way that develops and works from a base already. So we'll be looking at the literature that's already out there. We'll be looking at theory about how we help people change their communication behavior and change their skills. And most importantly, we're developing this training with members of the multidisciplinary team, patients and family members. And we've chosen intentionally to do this because when it's developed with our stakeholders for whom it's intended, we know that we'll deliver a better training programme. NHS England eLearning for Healthcare is a partner on ComStar, and they will be involved in both educationally and digitally designing our training and hosting the training for our staff across the UK. So why are we doing ComStar? In a nutshell, it's pretty simple. Our multidisciplinary staff who work in stroke care and rehabilitation delivery deserve better. And I'll say a little bit more about this in the coming slides. Equally, our patients and their families deserve a better deal during their stroke care and rehabilitation. And we know that in 2024, by working together in partnership across our different nations and across our different stakeholder groups, that we can do much better in this space. Let me talk you through our actual motivations and where they come from. So if we think about the SNAP data that has been available, the most recent data shows us that about 64% of stroke patients are admitted to hospital and they're identified on that point of admission as having aphasia, dysarthria, or both of those communication impairments through the NIS form. We also know that this is probably an underestimate of the communication challenges that face stroke patients when they enter our hospital and our rehab settings, because we know that dyspraxia and COG-COM are not identified on the NIS on admission. They'll be identified in different ways. There are huge expectations of our multidisciplinary stroke staff in terms of how they communicate with this subgroup, this large subgroup of stroke patients who've got communication challenges. So if we think and we use the stroke-specific education framework, which we have here in the UK and we're using in ComStar, our staff are expected to know and understand the communication effects of stroke. They're expected to be able to recognise these difficulties in interactions with patients. They're then expected to adapt their methods of communication and to have and use a range of communication methods, resources and approaches whilst providing care and rehabilitation. So it's a big ask. And we do this because we want patients, carers and families to be fully involved in the decision-making and care. But we know that that is a real challenge. And I suppose one of the greatest challenges we also have here in the UK is we don't really know how much training is provided to the multidisciplinary stroke staff team across the UK. Anecdotally, when we chat with clinicians like yourselves, we've heard that training is quite variable. Some patches and trusts and regions have really good training and it's consistent and it's regular. In other places, it's not that particular picture. In other places, it's much more limited and it's infrequent, so it's not regularly embedded into our organisational structures. There is some research that comes from Australia, which was a survey of speech and language therapists about training that they provide to the stroke team, and they would say that on average, they provide 1 to 2 sessions of around 30 minutes, and that's all that the team gets. We do know from looking at the research literature that interactions with stroke survivors who have communication impairments are quite time consuming. They feel quite hard. This is what staff tell us in these research papers. And also it frequently ends up being quite a negative experience. There's quite a negative impact on how staff feel about themselves after they've been in this interactional space with our stroke patients. So they say they're frustrated, they feel helpless and stupid, but it leads to an even further kind of downward spiral where staff start to panic or dread and even limit the interactions that they have with stroke survivors with communication impairments. And we want to be able to break that cycle completely in ComStar. We also know from the literature that staff in spaces like to stick to the here and now. So a lot of the communication that will happen is focused on needs that are present and visible, and that this is much safer. And also, we know that staff really want to help and do a good job in this space. And so this is where ComStar is going to be here to help. We also know that having some initial experience of a positive interaction, something that's successful, is a bit of a game changer for multidisciplinary staff then continuing to use those communication strategies or those new ways of communicating. If we move now from the whole of our multidisciplinary team more to looking at the expectations of speech and language therapists, it is embedded as part of our clinical role. And it doesn't matter whether we're looking at the NICE guidelines or the Royal College of Physician guidelines, that speech therapists should coach or train the people around stroke survivors with communication difficulties. And that includes the health and the social care team in optimal or supportive communication skills. Again, we've got a real problem here in the UK. We don't really know how much training is provided by speech and language therapists in our different clinical settings. And again, you can see on the slide here, we've got some anecdotal responses from people. SLT say they're very motivated to do this, but they're also very busy, so things that help us do things in a more standardized fashion or resources that have been developed particularly for this purpose are much more likely to be used than creating things each time we have this challenge. They also say that sometimes a lack of interest from others or lack of organisational support in this space means that it's not very motivating sometimes for staff. The research that came out from Australia also highlights a number of different challenges and barriers that exist in our organisations and our structures. So way beyond a kind of what an individual clinician will do. And there is a need to really change how we see communication skills training at a really high level in the UK. So finally, coming to our patients and families' experiences. We've spoken to a lot of patients with communication difficulties and their families in preparing ComStar before it was funded, and we continue to talk to patients and families, and overall they experience a lot of these negative consequences and emotions that you can see here on the slide when they have these challenging healthcare conversations with staff. And so again, ComStar wants to be able to break this from happening. This can lead to quite negative situations for patients and families. There's risks of preventable adverse events and also poorer outcomes. And we know this from our SNAP data based here in the UK. We're currently working on ComStar with 10 stroke survivors and family members with communication impairments. And they've asked us to think about these things here that you see popping up on the slide when we are communicating with people who've got aphasia, dysarthria, dyspraxia, or cognitive communication difficulties during care and rehabilitation. And the things which are popping up on the slide are not necessarily very challenging things to do in terms of how we change our communication, but again, they'll be much easier to implement if we're looking at national standardized training across the UK and resources that everyone can use that are fit for purpose. So Rebecca and I lead quite a large team of clinicians, clinical academics and researchers. So this is our study management group. We have representation across the UK and in Scotland, and we also have input from overseas, from colleagues in Denmark and Australia. Most importantly, most of our multidisciplinary team members are represented here. So we have people in occupational therapy, physiotherapy, medicine, nursing, and clinical psychology represented. I mentioned our PPI team before, but just to say, we have 10 individuals and family members who have this lived experience. They represent 3 of our 4 nations so far, and they're bringing a range of diversity to the work that we've already been doing since March. And we also have a study steering group who keep us on the straight and narrow as we go through our project. At this point, I'm going to hand over to Rebecca.
So thank you, Madeline. I'm going to talk a little bit about what we're going to be doing over the next 3 years and points at which you can get involved and help out with the creation of this new communication training programme. So in the first year, we're wanting to understand more about the current context of communication and communication training in stroke care. The second year will be focused on co-designing the new training package, and the third year will evaluate the implementation of this training package. So in the first year, we've actually got 3 different pieces of work that are being delivered concurrently. The first is to find out about what the current training is, if any, that's being delivered and accessed nationally in different places. And we're doing this through an online survey, which launched only a few days ago. This is for all different types of staff who work with stroke survivors. That includes all the main professions and also assistants, care assistants, rehabilitation assistants, staff that might work in the kitchen or as housekeepers. So anybody that might interact with stroke survivors. And what we're wanting to understand through our survey is what training you currently provide or access, anything that makes training easy or difficult to access and complete, what it is that makes you want to do training around communication, and what helps or hinders use of communication skills that you learn through training. So it's really critical for us to understand what's important to include in training and how to deliver it. And that's why we really need to hear about your experiences and views. So if you could take 15 minutes to complete our survey, you can get to it through the QR code there on this slide. We're hoping for between 400 and 500 respondents to our survey from across the stroke MDT. And so I'm aware that there's quite a lot of speech therapists on the webinar this lunchtime. And if you do have contact with other members of the stroke team, it would be great if you could share this survey with them, and particularly with assistants and housekeeping staff who we may struggle to get to through our professional networks. Through completing this survey, you'd be contributing to the publication of key considerations that people need to think about in providing communication training, and also the shaping of this new stroke communication training we're wanting to make. And if those aren't incentives enough for you to fill in our survey, we also have 4 chances to win £50 through a prize draw. So thank you very much for your participation in the survey. Another piece of work that we're doing in the first year is to collect experiences of communicating in stroke care from up to 25 staff, stroke survivors and family or friends of stroke survivors. And we'll do this through recording interviews. Again, we really want to hear from a range of different types of people, different backgrounds, and different stories, different experiences that people have had in communicating in stroke care. So again, if you or someone you know would like to be interviewed, you feel you have experiences you'd like to share or particular stories of communicating, it would be useful to share, then do contact us on our project email address, comstar@sheffield.ac.uk. Okay, so from these interviews, we'll use those to put together a short film that illustrates the impact of communication on staff, patients and families. And this will be fundamental to setting the scene at the beginning of the co-design process. The third piece of work we'll be doing in year one is a systematic review of stroke staff communication training. So we'll find out from what's been written in the literature, what's been tried before, what training consists of and how it gets delivered, what helps to improve communication, what outcomes from training we should be looking for, and if there's any implementation strategies that are helpful. And from this information, we'll construct a theory of what needs to be in that training and what the outcomes should be. We also want to make a communication checklist, which will include items that illustrate what good communication between staff and patients look like. And we'd make this freely available for people to use in their services or in their own practice to think about their communication and how it's going for you. On to year two. So in year two, we're going to focus on co-designing the staff communication training. We're going to invite 6 stroke survivors and family members and 12 staff from across the multidisciplinary team to be co-designers. 9 people will meet in London and 9 in Sheffield, and the groups will be linked remotely. We're planning 10 3-hour workshops between March and December 2025. And we recognise that this is quite a big time commitment, and so we will be offering payment to all co-designers. The method we'll be using is the experience-based co-design method that I'm sure many of you are familiar with. And there are various opportunities for you in taking part in this as a co-designer. So you'll have the opportunity to experience the EBCD method, to have a look firsthand at all the data that we've collected from year one of the project. You'll have the opportunity to work with staff from different areas and really listen to stroke survivors in that group. And you'll have the opportunity to work with designers from NHS England e-learning for healthcare. Importantly, you'll be key to designing the shape and content of the national communication training and any communication resources that go along with that. And finally, we'll have a big celebration event which you'd be invited to, which also provides you with lots of new networking opportunities. So again, if you see yourself in this role, or this is something you'd like to talk to us more about, do contact us at our email address and we'll be in touch for some further conversations. So then in year 3, we're going to evaluate the implementation of this training at 4 different NHS trusts across the country, 2 of them in London and 2 of them in South Yorkshire, because we want to see how this training goes in different trusts that serve a very big diverse population that NHS stroke services might be serving across the country. Our sites range from acute trusts, acute stroke pathway settings through to community settings. And what we'll be doing is trying to find out what affects implementation of training and what helpful strategies people find, how many people actually complete training when it's offered, whether it's acceptable and feasible, any change in staff communication knowledge following training, and whether trained staff actually use their new communication skills in their patient interactions. We'll also be interviewing patients who've interacted with staff who've received the training to understand their experience of engagement in care and rehabilitation with these staff. And we'll be thinking about how training might become a standard part of practice and not a one-off event. On the right-hand side of the slide, you can see the methods that we'll be using to gain that information. And finally, after the evaluation, we'll have a further co-design workshop to refine the training with the information from the evaluation, and finally launch our free training package as part of NHS England e-learning for healthcare suite of e-learning, which will include training, communication resources, and implementation tips and strategies. So if you'd like to continue to follow the project as we go through the 3 years, we have a website there on this slide. You can also follow us at X, formerly Twitter, on @wearecom_star. And if you haven't already signed up to our emailing list or mailing list, then there's a link for that there. Just to remind you, if you didn't get the QR code from a previous slide, there it is again there. I can see that there might be a few problems with it from the chat, and we'll address those shortly. And here's our email address again, if you're interested in contacting us about being interviewed or being part of co-design. So all that remains for me to say is thank you very much for joining us over your lunchtime for this webinar. And we've got a few minutes left for any questions you might have. If you'd like to raise your hand using the hand function,